Mental health is an essential aspect of our overall well-being. Unfortunately, mental illness can affect anyone, regardless of age, gender, or background. Recognizing the signs of mental illness is crucial for early intervention and effective treatment. In this video, we explore 8 common indicators that may suggest the presence of a mental health condition. 1. Persistent sadness or mood changes. One of the most prevalent signs of mental illness is persistent sadness or a noticeable change in mood. Feeling down, hopeless, or overwhelmed for an extended period might indicate depression or other mood disorders. 2. Social withdrawal. If someone who was once social and engaged starts isolating themselves from friends, family, and activities they used to enjoy, it could be a sign of mental illness. Social withdrawal can indicate anxiety, depression, or other related conditions. 3. Intense fear or worry. Experiencing extreme fear, worry, or anxiety that affects daily life could signify the presence of an anxiety disorder. Panic attacks, irrational fears, and constant worry are common symptoms to watch for. 4. Significant changes in appetite or weight. Sudden changes in appetite or significant weight gain or loss might be indicative of underlying mental health issues. Eating disorders, depression, or anxiety can often manifest through changes in eating habits. 5. Disturbed sleep patterns. Sleep difficulties, such as insomnia, oversleeping, or frequent nightmares, can be linked to mental illness. Disrupted sleep patterns may be seen in conditions like depression, anxiety, or bipolar disorder. 6. Lack of concentration or decreased ability to think clearly. Experiencing difficulty focusing, making decisions, or thinking clearly can be signs of a mental health condition. This cognitive impairment could be associated with depression, anxiety disorders, or attention deficit disorders. 7. Unexplained physical ailments. Physical complaints like headaches, stomach aches, and back pain that have no clear medical cause can sometimes be linked to mental health concerns. Psychological distress can manifest as physical symptoms, often referred to as somatic disorders. 8. Substance abuse and risky behaviors. Engaging in substance abuse, excessive drinking, or other risky behaviors might be an indication of underlying mental health issues. Individuals often use these substances and behaviors as coping mechanisms, highlighting the need for mental health support. These signs are not meant to diagnose any specific mental illness, but rather to alert you to the possibility that something may be wrong. If you experience several of these signs at one time and they cause serious problems in your ability to function, you should seek help from a mental health professional. Early intervention can often minimize or delay symptoms, prevent hospitalization, and improve prognosis. So what are some common mental illnesses? Here are some common mental illnesses. Anxiety disorders. These are characterized by excessive fear and worry and related behavioral disturbances. Examples include generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. Depression. This is a mood disorder that causes persistent feelings of sadness, hopelessness, and loss of interest in activities. It can affect one's thoughts, feelings, behavior, and physical health. Bipolar disorder. This is another mood disorder that involves alternating episodes of depression and mania, a state of elevated mood, energy, and activity. It can affect one's mood, energy, activity, and judgment. Obsessive-compulsive disorder. This is an anxiety disorder that involves recurring, unwanted thoughts and repetitive behaviors, often performed to try and alleviate the distress caused by intrusive thoughts. It can interfere with one's daily functioning and quality of life. Post-traumatic stress disorder, PTSD. This is a trauma-related disorder that develops after exposure to a traumatic event, such as violence, abuse, or natural disasters. It can cause symptoms such as flashbacks, nightmares, avoidance. Eating disorders. These are characterized by compulsive, unhealthy eating behaviors and a preoccupation with one's body. They can have serious medical consequences. Some examples of eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Personality disorders. These are characterized by enduring patterns of thinking, feeling, and behaving that deviate from the expectations of one's culture and cause distress or impairment. There are many types of personality disorders, such as borderline personality disorder, antisocial personality disorder, and narcissistic personality disorder. Psychotic disorders. These are characterized by a loss of contact with reality and the presence of delusions and hallucinations. The most common psychotic disorder is schizophrenia, which affects one's thoughts, emotions, and behavior. These are not the only mental illnesses that exist, but they are some of the most prevalent and well-known ones. If you or someone you know is experiencing symptoms of any of these conditions, please seek professional help. There are effective treatments available, and recovery is possible. Now, how can I help someone with a mental illness? Helping someone with a mental illness can be challenging, but also rewarding. Here are some tips might be useful. Start a conversation. Show interest and compassion, and ask how they are feeling and what they need. Listen without judgment. Let them express their thoughts and emotions, and avoid giving advice, reassurance, or criticism. Validate their experience. Acknowledge their pain and suffering, and try to understand their perspective. Offer support. Ask how you can help, and follow through with your promises. Help them find professional help, resources, and support groups. Set boundaries. Be clear about what you can and cannot do, and respect their autonomy and choices. Practice self-care. Take care of your own physical and mental health, and seek support for yourself if needed. It is crucial to foster an environment of empathy, understanding, and support when it comes to mental health. By actively working together to destigmatize mental illness, advocate for resources, and promote mental well-being, we can ensure that no one faces mental health challenges alone. If you or someone you know is struggling with mental health, reach out to a healthcare professional or a helpline in your country to get the support you need. You are not alone. Thank you for watching.